So who am I? I'm Dr. Stephanie Capel. I'm a board certified fellowship and procedural trained dermatologist, and I have an office in Newport Beach, California. And I make these YouTube videos for you to provide educational content, for you to have the healthiest, best skin at every age, and also not fall into the bad outcomes that are existing now in aesthetics with people doing things that they shouldn't be doing and less than desirable outcomes or bad effects or complications happening. So it's my good duty to empower you guys, educate you so you can make the right decisions when it comes to your skin, aesthetics, skincare, and procedures. I trained at UCLA, which is a top 3 derm residency program after graduating medical school. And then I went on to do advanced laser and fellowship training and Mohs micrographic skin cancer surgery, which I've done for decades. And now I'm just purely doing aesthetics. And as a laser specialist, it is my passion. It's my passion to treat skin of color with lasers and to do everything in between in aesthetics, and also keep up to date with the newest, latest, and greatest information and keep you all in the know as well, as this is a very rapidly advancing field. So I hope you follow. The only way to grow, because I'm non-sponsored, I don't get paid by companies, is to share this channel with people who want non-sponsored, science-based, evidence-based content by a YouTuber who is a board certified dermatologist. I'm not a full-time YouTuber. I just do this because I love educating and empowering people. All right, you guys, hope you enjoy.
So I think it's also really important to understand the hair growth cycles, because once you understand how hair grows and the cyclical changes and percentages of each hair follicle in the growth phases, it makes more sense as to why things may be happening and what you can do to reverse those changes. So this is what we learned in our didactic series as dermatology residents. The hair shaft is made up by a hair follicle. The hair follicle, when you look at the skin on cross section, it's a follicle, like an invagination of the skin, and it's specialized cells, including infundibular, isthmus cells, stem cells. These are cells that are producing keratin to make a hair shaft, and they're in a constant state of growth, and that is what we call the anagen phase. The anagen phase is when your hair is growing. The telogen phase is when your hair is shedding. Now, at any given time, at anybody's scalp, when we're talking about hair on our head, because hair on other parts of our body is different. For example, eyelash hair has a very shortened anagen phase compared to hair on our head. That's why eyelashes are short and hair on your head is long. So anagen phase is usually 90% of the hair follicles on the scalp are in the anagen phase of growth, the growth phase. And at any given point in time, usually the catagen phase is 1% of the hair follicles, and the telogen phase is about 9% of the hair follicles. Now, there could be shifts and perturbations, and this can vary individual by individual. But for the most part, it's about 90% anagen growth phase and about 10% the telogen or shedding phase. And then there's, if you break it down from 9 to 1, there's like this transitional phase, which we call telogen, which sometimes they can call that 1% and the catagen 9%. But for all intents and purposes, most of our hair is in a growth phase cycle. And that's why when your hair sheds, there's only 10% of the follicles at any one time that are in the shedding stage of their cycle. And that's why you'll in the shower have a little bit of shedding in your hair, or when you brush your hair, you'll see maybe 5 to 10 hairs every couple of days, or maybe even every day, whatever your hair density and your cyclical pattern looks like. Now, when you start to have thinning of your hair or more shedding than usual, say you wake up in the morning and there's more hair on your pillowcase that's shed overnight, say when you brush your hair and there's a lot more hair in your brush, or when you're shampooing and conditioning your hair in the shower, you're pulling out more hair than usual. There has been a shift in the anagen and telogen growth phases in your hair. Now, that could be multifactorial. It could be a stressful event that happened, cortisol levels are up, hormone fluctuations, hormone changes, nutritional deficiencies. If you're losing weight, say you're on a GLP-1 agonist, there's a lot of different reasons why your hair can be shifting more from a percentage of being in the anagen phase to the telogen phase. Now, why that's happening is really important, and that's why I usually encourage my patients to go have a laboratory workup, see their primary care physician or their provider, and just get blood work done, because the blood work can tell you a lot about what's happening in the body. Do you have thyroid issues? Are you anemic? Are you iron deficient? Are you low on your B12s? There's so many different reasons why we could have hair shedding and hair loss and hair thinning over time, that if it's a simple fix as, I increase my vitamin B supplements, or I get a B12 shot, or, I have my thyroid under control, which it should be anyway for other medical reasons. It really gives a lot of insight, and most hair loss situations that are from some type of lab abnormality gets corrected once that ailment gets set back on track. Now, hormone fluctuations can also change the growth cycle phases of the hair follicles on your scalp. For example, when you're pregnant, you have a prolonged anagen phase. More of your hair follicles are in the anagen phase than when you're not pregnant. So if any given time, on average, the individual will have 90% of their hair follicles in the anagen phase and maybe 9 to 10% in the telogen phase. When you're pregnant, more like 95 to 98% of your hair follicles are in the anagen phase. That's why when you're pregnant during those 9 months, your hair is thick, it's full, you have a ton of hair. Then you have the baby and your hair sheds because it goes back on track, and all of those follicles that were supposed to be in the telogen phase but had been in the anagen phase for those 9 months shift to telogen, and then you're more of an anagen 70%, telogen 30% instead of an anagen 90%, telogen 10%. So hopefully that makes sense. In addition, after having a baby, that's a very big stressor on the female body. So you can have something called telogen effluvium. That's when 3 months after a stressful event, whether it be postpartum, a sickness, a high fever, loss of a loved one, loss of a job, something very stressful, 3 months later can cause a telogen effluvium, and that's when there's a shift in the growth phase cycles and you shed all of your hair. So that's another, it's kind of another example of the hair cycles and what percentage of each hair follicle is in which cycle and how those can fluctuate with time. Also, what made me understand that more when I was a dermatology resident is when we did laser hair removal. So for any of you who've had laser hair removal, now this can vary patient to patient and your hair density given on your genetic background, but say for example you're doing laser hair removal on the legs, for example, and say you do a laser at any given time, you'll have a great response. The hair will be reduced because at that point in time, 90% of your hair follicles were in the anagen phase. So when that laser treatment wiped out 90% of those hair follicles, it worked really well. That's why your provider will have you come back anywhere from 1 to 3 months later, because at that time, the dormant hair follicles were in their dormant phase or now in their growth phase. So you have these little kind of stragglers crop up. Then you wipe it out again with another laser hair removal treatment. And then if a third laser hair removal treatment is needed, it's to wipe out any of those dormant hair follicles that have been asleep that whole time, because the dormant hair follicles won't be receptive to the laser hair removal, but then once they enter the growth phase, they'll be knocked out by the hair removal treatment. So that kind of helped me understand the growth phases when I was a resident, so hopefully that will be meaningful to you too. Okay, now that we've covered that, let's get into the next topic. Okay, let's talk about hormones and how hormones affect hair growth and hair thickness. As women, we're in a constant flux of different hormonal changes, whether we're pregnant, whether we're PMSing, whether we're postpartum, perimenopausal, postmenopausal, cyclical fluctuations in life and throughout the months. We always have hormonal changes, and this can affect the hair follicles. As we have a drop in estrogen during a perimenopause period, we can have significant hair loss, especially for my female beauties who have triangular alopecia. Alopecia in medicine and dermatology just means hair loss along the hairline. Their part is wider, even the structure of their hair shafts, like say you had straight hair before and now it's frizzy. There's different changes that can happen in the hair, and this is immensely regulated and influenced by different hormonal fluxes. So if you're in a perimenopause period and you're noticing hair loss, you can follow up with your provider and see, what hormone fluctuations or drops are occurring, and maybe help supplement and offset those changes for increased hair growth. So a lot of my patients who are on GLP-1 agonists who are losing a lot of weight over a short amount of time can also be in a state of nutritional deficiency, and this will lead to hair loss or thinning of the hair. So for those of you who are having a dramatic weight loss, or if you're on a GLP-1 agonist, a lot of people ask me if I'm on one. I'm personally not on a GLP-1 agonist, but I have nothing against anybody who is, and I feel that a lot of my patients who are on GLP-1 agonists have had immense, beautiful lifestyle, healthy changes in a positive direction. So the offset of losing of their hair or thinning of their hair is just kind of a side effect of that, but does not outweigh the benefit of, being on a GLP-1. So for those patients who are almost in a nutritional deficiency state on the GLP-1 agonist, I just recommend that they see their primary care provider or provider just to check their lab works and do like a complete metabolic panel and just kind of a assessment of where their vitamin D level is, how their B12s are looking, their thyroid function, and just other ailments that may be course corrected by just using data obtained from a lab abnormality, especially for my beauties on a GLP-1 agonist. So nutritional deficiencies, even without a GLP-1 agonist, people who are dieting or cutting weight or being really mindful of how they're eating or their caloric intake, can be in a nutritional state of deficiency, also leading to hair loss. So we already talked about hormone fluctuations, nutritional status, and as with anything, living a healthy lifestyle, including you know, a work-life balance with decreasing stress, eating as clean as possible, eating a well-balanced meal every day or meals every day, getting good sleep to decrease your cortisol levels, doing things like walks on the beach, hiking, meditation, yoga, whatever it is to decrease your cortisol levels. I have a high school student now, so I definitely understand as a mom, you can get very stressed out, and being a mom, it can induce stress, which increases cortisol levels, which can help, you know, not only decrease hair growth, but also affect your sleep. So then you're not sleeping on top of that, throw in some perimenopause on top of that, and it's just like impossible. So I understand that many of us are suffering through different stressors that could be contributing to hair loss, and it may not be just one thing, it may be multiple things, but the best that we can do is make sure that we have a healthy lifestyle, and that's eating, exercising, decreasing your stress levels, getting good sleep hygiene, and with that, everything will fall into place, including beautiful skin and healthy hair. Okay, another cause of hair loss or decreased hair density or increased hair shedding can be hairstyles. So I recently went to an event and I had my hair braided. I loved it. It was darling. And sometimes I'll do this for like a little fun event here and there, but I had a traction alopecia. So traction alopecia is when there is strangulation of the hair follicle, and strangulation means there is decreased blood supply to the hair follicles. The hair follicles are very finicky. The hair follicles are made of stem cells and very rapidly dividing and active cells. That's why when someone goes through chemotherapy, the first thing that they lose is their hair, because those are the first cells to take a hit, because those are the most active and viable cells, you know, on our skin. And so what happens is when the hairs pull tight, whether it be from braids or even I love to rock a high pony, and I rock a high pony a lot of the times when I probably shouldn't, because there is that tightness that kind of strangulates the hair follicle, and the hair follicle has a very robust blood supply. That's why, like when we're doing surgery, I'm a retired Mohs micrographic skin cancer surgeon now, but when I used to do surgery, when we do it on the scalp, any of you surgeons out there know this, the scalp bleeds like crazy. You need Chalazion clamps, you need somebody to help apply pressure, because those hair follicles have so much blood flow, but they need that blood flow. And you know, when you do an incision on someone's arm, it doesn't really bleed as much. You cut open a skin cancer on the scalp and that thing bleeds like crazy. The lips too, but that's a very highly vascular area. But when you have your hair being pulled and that blood supply gets cut off from the follicle, the cells go, all right, we're done making a hair shaft, we're gonna shed now. And that's when you get that, what's called traction alopecia. So if you have like multiple braids or cornrows, the parts will get wider. If you pull your hair back in a high pony, like in a, you know, along the hairline, all that strangulation of those baby hairs can decrease the blood supply and then your hair shed. So that's what happened to me. And I'm now using Latisse, I'm taking Nutrafol, and I'm being really mindful of babying my hairline and baby hairs. So hopefully if you guys do hairstyles like that, you're just mindful and you can kind of put a little reverse tension, like you can almost, like if you have a high ponytail, like sometimes I'll kind of squish it down to kind of like relieve tension on those hair follicles, because a traction alopecia is not fun. Okay, let's talk about some of the treatments for alopecia or hair loss. Now PRP, you'll see a lot of that online. PRP just is platelet-rich plasma. You can always have PRF2, platelet-rich fibrin, and what this is we basically take a blood draw from a patient and we process the blood products and we basically inject it back into an area of hair loss, and it tends to have a really beautiful outcome and great result depending on the cause of alopecia or hair loss, but for most intents and purposes, people do really well with PRP injections into the scalp. Now it doesn't have to be microneedling, it can be microneedling, or you can inject it directly into the scalp. It's a very viscous, meaning a very thick fluid, so the thicker density of an injectable into the skin, the more it hurts. So it's not the most pleasant feeling. I've never personally had it done, but you know, studying this and doing this procedure on patients, you know, you do see that it is a little bit more uncomfortable, but it works really well. Now PRP is very useful, I think, in hair growth from what my research has shown me and from my education, because it's anti-inflammatory also, and it also helps increase blood supply, it helps provide nourishment to the hair follicle cells, but I do think that it has a very powerful anti-inflammatory effect. That's why PRP is also used in orthopedics or musculoskeletal injury. If a pro athlete will have a knee injury and you inject the PRP, it usually can help resolve the problem. Now, PRP doesn't have as much data for anti-aging, although we do use it for example, as a filler alternative. A lot of my patients are shying away and not wanting to do filler these days. PRP and PRF in the form of Easy Gel, if you want to refer to that video, you can watch it, but is a great way to help help naturally restore volume and increase collagen and elastin synthesis. So anecdotally, we do know, and there is some data supporting PRP and PRF for anti-aging effects, but it's said in our data and our literature that there's a lot of anti-inflammatory component to the treatment that helps restore hair growth. Okay, next let's talk about Minoxidil or Rogaine, because a lot of patients ask about this. This is a topical over-the-counter hair serum that you can use for hair growth. Women's is 2%, men's is a 5%, so I always recommend if patients are going to use Rogaine, whether they're male or female, to just use the 5%, the male version of it, because it is a little bit stronger. So the mechanism of action in which Rogaine works is that it affects the potassium channels, which causes vasodilation or opening up of the blood vessels, which supplies more blood to the hair follicles to help stimulate hair growth. It also keeps a prolonged anagen phase. As we talked about before, it's a prolonged growth phase, and it shortens the telogen and catagen phases. The problem with Minoxidil, though, however, there's a couple problems. First of all, if you apply it to your scalp and you accidentally drip some on your forehead or on your face, it will grow hair, which we call hirsutism or hypertrichosis, in those areas. So if you don't want sideburns or a mustache if you're a female, try not to get it on your face in those areas. The other problem that I think most patients have the biggest problem with is that it is going to work for as long as you're going to be on that product, but the minute you stop it, you're going to be right back where you were had you never used the Minoxidil in the first place. So the reason why it keeps it in a prolonged anagen phase and keeping all those hairs in the growth phase, because of this mechanism of action of increased blood flow and vasodilation and affecting the potassium channels, once that goes away, it shifts all those hair follicles back from the growth phase to where they all would have been in the telogen phase, and you get all this hair shedding and you're back to being as bald as you would have been before had never using it. So that's just something to be mindful of, and I think for my patients personally, a lot of people don't want to do this treatment because of that side effect or caveat. Okay, next let's talk about Finasteride, also known as Propecia. So whereas Minoxidil stimulates hair growth, what Finasteride does is it prevents hair loss. So this is common among androgenic alopecia or male pattern baldness. It's an oral medication, it's usually prescription, and it could be used to help prevent hair shedding. And because science is my first language, let's talk about mechanisms of action. How does Finasteride work? So it blocks the conversion of testosterone to dihydrotestosterone, which is the product that's responsible for hair loss, especially in men. So what Finasteride does is it's an inhibitor of 5-alpha reductase, which is the enzyme that blocks that conversion. So you're decreasing the testosterone derivative that causes hair loss. So side effects of Finasteride include mood disturbances and decrease in hormone levels, which can affect libido and other testosterone-driven physiological changes. So a lot of people are now preferring the topical version so that you're not taking an oral GI route for decreased systemic absorption and more of a topical application, because the Finasteride can, affect mood, stress, sexual activity, and so forth. The topical has gained a lot more popularity because it helps decrease hair shedding without those deleterious side effects that you see with the oral Propecia or Finasteride route. Okay, another treatment is Latisse. So for those of you who aren't familiar with Latisse, Latisse is a prescription strength hair lash serum. It does have its potential side effects when you're using it for lash growth. I no longer use it for my lashes. It can cause infraorbital fat pad demutation and a lot of other hyperpigmentation and other side effects. A lot of people do use it, and a lot of my patients are fans of it. I personally no longer use Latisse for a lash serum enhancer, but it can be used for the same reason on your eyebrows and on your scalp. I know a lot of post-chemotherapy cancer patients have used Latisse for hair growth on the scalp and on the eyebrows as well. And the first thing I did when I took out my braids and I saw my traction alopecia along my hairline is I dropped some of my Latisse onto it, because that's what I just happened to have in my medicine cabinet. You have to be aware of Latisse though. It can cause hyperpigmentation, and it can also cause hypertrichosis, which is where you get hair in areas you do not want hair. Okay, I'm actually not going to be talking about surgical correction, hair transplantation, FUE, and different lasers for hair restoration in this video, but if you'd like, I can discuss it in another video. I wanted to keep this topic just things that you can do at home, and it's just in the office without undergoing surgery or some dramatic radical treatment for hair restoration. So including topical and oral agents that you can use at home, and just lifestyle changes, decreasing stress, sleep hygiene, eating clean, eating healthy, exercising, and just having an overall healthy lifestyle. Other things that we can do is supplementation. Now there's a ton of skin and hair supplements on the market, what works and what doesn't. Anecdotally, a lot of patients respond to Nutrafol. Again, I'm not an affiliate, I don't have any paid partnerships with any companies, but just on our different forums and at academic meetings when we stay on top of our continuous medical education and dermatologists are talking amongst ourselves, a lot of us recommend Nutrafol for our patients. I actually Amazoned some of my own because I needed to correct my traction alopecia. I just started about a week ago, so I don't have any results for you yet to report, but maybe I could do a video later on that. But usually it takes about 3 to 6 months to see an improvement. So people will often get frustrated and stop early and think that it doesn't work. But I do think that the longevity is really, really important. It's kind of like tretinoin. You got to be in it for the long haul to see the benefits of it. It is hard because it is 4 pills at once. And for those of you who are like me, I have a sensitive stomach and I can't intake a lot of food or supplementation at once. It's a little bit of a challenge. It doesn't make me queasy, but for those of you who are a little bit sensitive, just be mindful of that because it is a lot. There's 4 pills. The most important active ingredients, based on my history and research and my education that I've looked into, taking a deep dive in important actives for hair supplementation. I did a hair supplement video about over a year ago, so I can just do a hair supplement video if you'd like me to for the future. But the ashwagandha is really important. The polyphenols is really important. Of course, DHAs and omega-3 fatty acids are really important. Curcumin, saw palmetto, collagen peptides. Of course, they have to be the collagen peptides, not proteins. Also, stinging nettle has shown a lot of data in our literature. Theanine and B complex. There are many more, but those are the main hitters that I think that are really, really important active ingredients, especially the vitamin B, you guys. Especially for those of you, I actually have a genetic permutation that doesn't allow me to absorb vitamin B12 through the enteric route, like by taking it orally, so I have to do vitamin B12 shots. I do take a sublingual form of it, which happens to work for me, and I get my labs checked every 3 to 6 months. And then just making sure that you have a well-rounded nutritional status and diet and supplementing in areas where you fall short. And if you want to kind of take the Nutrafol supplement, there's different types for different phases in life or different categories of different patients, so it can kind of be a little bit more customized, but I feel like those are the most important active ingredients. You can also refer to my video that I did in the past on hair supplementation, but I think I need to do an updated video on that as well. Okay, when talking about supplements also, because I mentioned the collagen peptides, when you're supplementing, you always want to make sure that the bioavailability of the active ingredient is going through the bloodstream. It's going to get uptaken into the area where you want it to have an effect. For example, if you're taking collagen peptides are going to, first of all, they have to be bioavailable. Sometimes they just go right through the GI tract and they never get into the bloodstream to be transported to the skin, hair, nails, or wherever you want them to go. But then also, if it does have good bioavailability, that's just the first half of the battle. The second half of the battle is making sure that it ends at the endpoint in the targeted area where you want it to go. In science, you have source and sink. You have the source of the active ingredient, the bioavailable product, and you have the sink, where it's going to end up. So if you take collagen peptides and you want it to go to your skin, it may go to your eye, your cartilage, your bone, your teeth, other areas that are going to be uptaken to make collagen. So if you are having hair loss, usually you have a kind of like a draw for the collagen peptides or the building blocks of collagen to go to the source where it's deficient. So usually the bioavailability is really important in understanding how you can shunt the products or the actives to go to the area that you want it to go. Usually if there's a deficit, you'll be upregulated into that area. Or say, for example, you have a collagen banking procedure like Thermage or Fraxel, and your skin needs the building blocks to make collagen, you'll basically have the collagen that gets taken up by the bloodstream to go to that area. But if you don't have a deficit or a stimulus for collagen synthesis, it may not go to the areas where you want it to go. So let's next talk about LED lights for hair growth and red light for hair growth. Now, I know that there's a lot of devices on the market out there that are available to consumers to pay and use at home to help restore hair growth. I do think that there are some of these devices that do work, but to be honest, these devices can be very expensive. They can be time consuming. They have shady return policies, and there's a huge market in aesthetics, you guys, that they're predators for women willing to pay a lot of money for treatments that are not only they're not FDA approved, but they're not backed by science, and they're just trying to make money with zero results. So just be mindful of that. I'm not saying that about all LED and red light masks or scalp treatments or hats, but I do have a lot of colleagues who, after going through medical school and dermatology residency, and some even after fellowships, have decided to not see patients anymore, shut down their clinics, and be full-time YouTubers and getting affiliate paid, checks from these big companies promoting products that they may not even use, they may not have recommended for their patients, but they're being paid to promote them. And so it's just the good, the bad, the ugly, the behind the scenes of dermatology and aesthetics. So just be careful, because just because a dermatologist recommends an LED mask that is very expensive, it may not even work, and it may not be something that he or she would recommend if they weren't getting paid to recommend it. So just keep that in mind. But supposedly the red light masks for hair growth work by decreasing inflammation, increasing blood flow, and increasing cellular energy. But as a scientist, if you have a background in science, you'll understand anything that's going to increase blood flow is going to increase inflammation, not decrease inflammation. You can't it's like saying, I'm going to open the door and let the water in the room, but I'm not going to get the room wet. Like, it goes hand in hand. If you're increasing the blood flow, you're opening the doors for blood flow, you're going to increase the inflammatory cascades in the skin. So, the science is kind of shady unless you speak the language. It sounds amazing, in the marketing, but if you're really a scientist and you break it down, it doesn't make any sense at all. So, hate to be negative, but also have an obligation to protect you guys. Not all LED light and red masks for hair. I'm just saying there's some out there that may just be a total waste of money. So last, I kind of wanted to break down the different forms of alopecia. So alopecia, again, in dermatology just means hair loss. You can have scarring or non-scarring alopecia. Scarring alopecia is when the hair follicle is no longer viable and no longer able to be viable. This is when you have some traumatization of the hair follicle. Now, there's like dissecting cellulitis, and there's a lot of dermatologic conditions that will lead to a scarring alopecia. And when you look at the scalp hair on biopsy, it's all fibrotic. There's no viable hair follicle cells making hair anymore. The non-scarring alopecia is when it's not scarred, so although the hair follicles are dormant or they're shedding or they're not in a growth phase, with the right ingredients, it's like watering a seed. It can grow a plant. It may not be maybe a seed that's deep down under the dirt, but it's there and it's capable of being viable and growing a new fern or leaf or a hair shaft. So by watering it a little bit, giving it a little bit of love and sunshine, it'll grow a hair. So the types of non-scarring alopecia include androgenetic alopecia. This could be male, female, anything that has to do with hormone changes. Alopecia areata, which is when you have an immune attack, your immune cells are attacking the hair follicle itself, and you have like little patches, little circles of, which is areata, means that in dermatology, like little circular patterns of bald spots in your head. That responds really, really well to interlesional Kenalog or steroid injections. You have telogen effluvium, which we talked about before, some, disruption, childbirth, or a stressful life event or nutritional deficiency can cause a telogen effluvium where you're more in the shedding phase than the growth phase. Anagen effluvium is more related to people undergoing chemotherapy or medications that can cause the anagen effluvium. Also has a good prognosis once the insult is removed from the patient's life. Also dermatitis, so different, seborrheic dermatitis, psoriasis, sebopsoriasis, eczematous dermatitis, tinea capitis. There's a lot of dermatologic conditions. Once you get them back on track and treat it, your hair follicles will get back into their place and pick up where they left off. So if your hair is non-scarring, which I feel most of people watching this video, it would be, because it's probably nutritional, hormonal, stress, being a female, different effects in our life that are going to temporarily cause our hair to shed. Most people have non-scarring alopecias that do have hope. So don't give up. You'll get that back, and there's things that we can do in our life to flip the switch and get those hair follicles actively and viable to the point that they were before whatever happened in your life, to kind of make this shift. So there's always hope. Be positive, and I hope you found this video useful. And if you have any questions, please just drop a comment in the comment section. And if you guys can share stories among yourselves of your hair loss journey and what worked for you, what didn't work, I think this is a safe forum and community where we can all help one another. All right, you guys, I will see you next week. Let me know what you want me to talk about next week. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.